Welcome to Shades of Migraine, a podcast series created by the Association of Migraine Disorders. We hope you'll enjoy listening to a wide variety of voices, including the perspectives of people living with migraine and those that are trying to help. Each will share their unique shade of migraine. In this episode, you'll learn about Hartford Healthcare's innovative multidisciplinary headache center, which uses a collaborative care model and administers tailored treatment plans. Our hope is to have more centers like this in all states across the country in the near future.
Teva is committed to the goal of transforming the lives of those suffering from migraine by creating solutions to reinvent the migraine paradigm by placing people at the center of everything they do. You can visit www.moretomigraine.com for tools and resources for living with migraine.
Hi, my name is Dr. Brian Grossberg, and I'm the Medical Director of the Hartford Healthcare Headache Center, which is part of the Iyer Neuroscience Institute at Hartford Healthcare in Connecticut. Established nearly 3 years ago, our vision has been to develop a nationally renowned, comprehensive, academic, multidisciplinary headache center that delivers personalized headache care through a collaborative care model. Over the last 3 years, we have built 3 multidisciplinary headache centers geographically situated across the entire state of Connecticut, with one of them located in Waterford, which is less than a half hour from Westerly, Rhode Island, and less than 1 hour from Providence, Rhode Island. One of the unique aspects of our headache program that distinguishes us from many other academic headache programs across the country is the development of our collaborative care model. By definition, a collaborative care model for headache involves the integration of complementary multidisciplinary services to uniformly deliver high-quality personalized headache care. To do this, we established the first multidisciplinary headache council in the entire country, composed of every discipline that intersects with headache medicine across our entire healthcare system, including primary care, women's health, maternal fetal medicine, neuroradiology, pain medicine, urgent care, emergency medicine, physical therapy, vestibular therapy, neurotology, sleep medicine, ophthalmology, psychiatry, neurosurgery, psychology, and finally nutrition. Through monthly council meetings, we have begun to operationalize and streamline the uniform delivery of each of these services through our headache program in an effort to ensure that patients receive the same high-quality care no matter which of the 3 headache centers they visit. Using this collaborative care headache model, patients can be seen by multiple specialists who then confer in an integrated effort to design a tailored treatment plan. One example of the unique nature of this multidisciplinary headache council is the creation of a headache special interest group of physical therapists geographically situated near each of the 3 headache centers who receive regular mentorship and education by a select team of senior physical therapists specialized in headache care and by our own headache specialists. This allows the referring headache specialists, like myself, to have a high level of confidence and familiarity with each of the treating therapists' knowledge base for evaluation and plans of care. In addition, the physical therapists use the electronic medical record system to regularly update the headache specialists on our patients' clinical progress. The Multidisciplinary Headache Council also enables us to create very innovative programs. One example of this is the establishment of a headache and hormone clinic overseen by a gynecologist who is thoroughly familiar with the literature surrounding headache across the various hormonal milestones of a woman's life and is available for questions regarding hormonal and non-hormonal forms of contraception and hormonal replacement therapy. Multiple future innovative programs are also being developed. One of these initiatives involves creating specified urgent care centers that are geared to treat established patients who don't respond to their conventional acute treatment regimen. Established patients would be given a written set of emergency instructions, also known as a migraine action plan, to bring with them to select participating urgent care centers geographically situated next to each of the headache centers when they are experiencing a severe migraine that doesn't respond to their acute migraine medications after office hours or on the weekend. These urgent care centers will be able to evaluate and treat them promptly by administering intravenous fluids and intravenous medications in a dimly lit and quiet environment. A second example of this innovation is the development of a women's healthcare headache initiative, in which an education and needs-based survey was recently administered to more than 250 women's healthcare providers across the entire state of Connecticut, seeking to determine migraine knowledge and current treatment patterns across various hormonal milestones. Following the review of the collected data, educational interventions will be performed with all of these women's healthcare providers to help strengthen their knowledge base on migraine and ultimately improve patient outcomes. A third example of the uniqueness of our headache program is an intensive one-week multidisciplinary program that is designed for headache sufferers whose lives have been severely disrupted. The comprehensive nature of the program simultaneously addresses medical, physical, and emotional needs, combining medical management, physical therapy, and individual psychotherapy. Traditionally, headaches have been treated exclusively with medications. While this is often helpful, in some cases reliance on medication doesn't resolve the headaches and may even make them worse. Prolonged inactivity due to pain can also cause other pain problems and make it difficult for headache sufferers to continue participating in work, social, or recreational pursuits. A team approach like the one done here, which includes a headache specialist, physical therapy, pain and stress management techniques, and medication adjustments, can address all of these issues. This unique intensive multidisciplinary care program occurs over 1 week with evaluations by a headache specialist, physical therapist, and a behavioral health psychologist. The team then formulates a joint treatment plan with input from the patient, which is used to guide the remainder of treatment. While some reduction in pain is common, treatment focuses on proving one's ability to function in the face of pain rather than on completely eliminating pain. We also strive to convert their daily headaches into a more episodic pattern. By encouraging the resumption of normal activities, the program places patients in charge of their own recovery and seeks to empower them and to break the passive crisis and rescue focus of prior care. For the 4 days following the initial evaluation, most patients receive intravenous medication infusions in a dim, quiet environment aimed at quickly removing medications contributing to headaches and/or sedation in a controlled setting. The infusion procedure also allows establishment of appropriate headache preventive medications. Headache specialists such as myself will teach patients how to use their preventive and headache abortive medications properly to minimize headache without impairing function. Most patients report feeling considerably better mentally and are less sedated following these infusions. This unique program also provides individualized physical therapy sessions. These emphasize improvement in strength, flexibility, and endurance through structured exercise. Psychological interventions occur during the week as well. Most of the psychological treatment helps reduce any depression and anxiety patients may have been feeling, as well as to eliminate pain behavior. Multiple relaxation techniques are taught, both for pain control as well as to enable patients to avoid panicking during a pain crisis. These skills are enhanced by individual biofeedback sessions and cognitive behavioral therapy. Patients completing the program have reported significant decreases in the severity and frequency of their headaches, increases in improvement in daily function, and improvement in mood. The program staff plans follow-up visits to determine the stability of the changes each patient has made following discharge and to promote further progress. Another benefit to our headache patients, which I'm very excited about in the future, will be access to telehealth services. Hartford Healthcare is embarking on a 3-year strategy to establish a state-of-the-art, system-wide, full-scale telehealth program offering patients care when they need it, where they need it. This will be achieved through an integration of in-person services mixed with services provided via telehealth technologies. The goal is to create multimodal channels of care across all service lines and care continuums by leveraging telehealth technologies to improve patient access, the patient experience, and the quality of care while reducing the overall cost of care. Video telehealth is a live interaction between a headache specialist like myself and a patient or between healthcare providers. We recently piloted using live video with patients at the Hartford Healthcare Headache Center and found it to be very successful. The plan is to continue to expand the pilot program later this summer using the Epic electronic medical record-based system telehealth platform. In the future, we plan to use biometric device integration for our headache patients to capture their headache diary data, response to medications, sleep patterns, stress level, exercise status, trigger identification, and other factors. Biometric device integration utilizes devices to complement video visits. These devices would be aimed at remote patient monitoring or biometric tracking and can provide headache specialists with important information and context during a video visit. They also allow physicians and care coordinators to manage a larger number of patients and engage patients in proactive self-management of their headaches and teach patients how to adjust behaviors. I'm very excited about all of these technologies and innovations that I've spoken with you about, and I look forward to helping your patients here at the Hartford Healthcare Headache Center. Thanks.
Teva is committed to the goal of transforming the lives of those suffering from migraine by creating solutions to reinvent the migraine paradigm by placing people at the center of everything they do. You can visit www.moretomigraine.com for tools and resources for living with migraine. Migraine Monitor is an intuitive headache tracking app with a unique opportunity to connect you to your headache specialist, prepare insightful reports, and invite you to an anonymous support group. Text migraine to 41411 to download Migraine Monitor today.
And thank you for tuning in to Shades of Migraine. For more information about migraine disease, please visit migrainedisorders.org.